Your donor area is not a bottomless ATM. Once it's over-harvested, the damage is permanent. Today, I'll show you how to avoid the moth-eaten look, what safe extraction actually means, and how top clinics plan your lifetime graft budget, so you don't pay for a mistake you can undo. Hi, I'm Dr. Ko. When doing hair transplant, your donor area is a very crucial aspect in doing the surgery. Think of your donor like a savings account you need for life. Every withdrawal must be strategic. Good surgeons plan not just for your first transplant, but for your future hair loss pattern. Bad planning? You get patchiness, see-through donor, and no backup when you need a second surgery. How many grafts can you take? Depends on three things: baseline density, hair shaft caliber, and risk of future loss. But there are practical guardrails. 1. Lifetime cumulative in the true safe zone. Typically, you can harvest up to 4,000 to 5,000 grafts throughout your lifetime. 2. Spacing rules. There should be no adjacent extractions in clusters. Use a micro-patterned, randomized spread to preserve visual density. Screening. Rule out dupa and retrograde alopecia before you harvest. If the entire donor is unstable, even small extractions can look bad later. Overharvesting creates checkerboard patchiness, what patients call the moth-eaten look. It happens when clinics chase big numbers in small areas, harvest outside the truly permanent zone, or do dense extractions without spacing logic. To avoid it, there are things that I personally do. First one is to map the donor into microzones and cap extractions per zone. Also, do randomized extraction so the eye never sees a pattern. Leave buffer bands at edges of the safe zone. And stop early if visual density starts to collapse under normal lighting, not just under clinic lighting. High-skill clinics don't guess. We calculate. Here's the simple version. 1. Measure baseline follicular unit density. For example, 70 to 90 follicular unit per square centimeter. This number varies by patient. 2. Define the true permanent zone and exclude risky margins. 3. Estimate safe lifetime harvest. Often 30 to 40% of follicular units in that zone. Then adjust for hair caliber. 4. Allocate grafts by priority. Hairline singles, frontal density, mid-scalp and crown. 5. Reserve a future buffer for progression. If you're headed to a higher Norwood, you'll need that reserve. If a clinic says unlimited grafts or can't show you a donor map, that's a red flag. To avoid red flags, you need to remember these. First one is to watch out for mega session guaranteed, regardless of your donor. Second is to avoid technician-driven harvesting with minimal surgeon planning. And if there is no discussion of lifetime graft budget or future loss, be aware. Also, watch out for price per graft only marketing. There should be plan for future outcomes or preservation plan. 5. Be aware of aggressive nape or temple harvesting presented as bonus grafts. Your donor is a finite asset. With careful math, conservative density targets, and real surgeon oversight, you can get great results and keep options for the future. If you're considering Korea for a hair transplant and want a donor-first strategy, I'm happy to review your case and map a lifetime plan with you.